Returning home. It is important that you take measures to protect your healing joint once you return home. If you have had an anterior hip replacement with an incision in the front of the hip, be careful not to kick your leg backwards and avoid sitting in a figure 4 position. When putting on your shoes and socks, you should bend forward instead of lifting your leg to your lap. Try to minimize twisting your body, keeping your knees, hips, and shoulders facing the same direction. The incision from your surgery will fill with blood and nutrients to help with healing. That can result in some swelling and warmth. This is normal. While resting, elevate your leg so that it's higher than your heart. Applying an ice compression can also help. Call your doctor if the swelling or warmth is excessive. After surgery, your doctor will have placed a waterproof bandage called an Aquacel dressing on your joint. It is antimicrobial, which means it helps to prevent bacteria, wicks away moisture, and is typically good for 14 days. Because it is waterproof, you can shower with it. Do not remove the bandage. Your home health nurse or physician will remove it 12 to 14 days after your surgery. You may also have a pressure dressing for the first evening to help decrease swelling and bleeding before your Aquacel waterproof bandage is applied. It is important to get up once every hour during the day and take small walks in your house to the bathroom or the kitchen just to stretch your legs and help prevent blood clots. Sometimes patients are prescribed a blood-thinning medication. You will be given a rechargeable wrap called a sequential compression device, or SCD, that goes around your calf, gently squeezing to mimic walking. Wear your SCD anytime you will be sitting or resting for 30 minutes, including when you go to bed at night. You will also be given a breathing device called a spirometer, which helps you inflate your lungs and prevent pneumonia. It should be used 4 to 6 times every hour while you are awake. If you experience tenderness in the calf of the leg you had operated on, please avoid rubbing your calf as that could release a blood clot that may have formed in your leg. Instead, notify your doctor immediately. Most patients return home after surgery and immediately begin outpatient therapy. Some people may start with a home health nurse and therapist who comes to the house several times a week. The nurse or therapist will often remove any staples at your incision site and the wound dressing on the 12th post-operative day. From there, you may transition to an outpatient facility for continued therapy. Occasionally, we will recommend that a patient go to an inpatient rehab facility for a period of time before returning home. Our team will discuss your plan of care with you, including what your health insurance covers. After surgery, you should carry a small card in your wallet to alert first responders that you've had a joint replacement. Even with your card, you may still be asked to pass through the X-ray machine at the airport if your new joint triggers the metal detector. Please call with any questions. Thank you for choosing UM Upper Chesapeake Health for your joint replacement surgery.